And good evening, everyone, and thanks for joining us tonight. Like Ashley said, I'm Dr. Timothy Fulham. I'm an active duty Air Force neurologist and neuromuscular specialist, currently stationed in San Antonio, Texas, where I serve as the Associate Program Director for the Neurology Residency. I also serve on the Pipeline Subcommittee and have been helping the AAN with some of these webinar series over the past couple months. So just in a little bit of overview about tonight's program. So the first 15 minutes, we're going to focus on the structure of and resources for away rotations. And then we'll kind of move into general advice for away rotations and how to do well. There will be 15 minutes at the end for you to ask any questions to the panel. So please utilize the Q&A feature on this webinar in order to submit your questions. So tonight, I'm excited to introduce our panelists. We have Dr. Felicia Glicksman, Joy Josephs, and Dr. Neil Mazenkai. So Dr. Felicia Glicksman practices pediatric neurology at the Joseph M. Censari Children's Hospital at Hackensack University Medical Center. She's the vice chair of the Department of Neurology at Hackensack Meridian Health School of Medicine, where she's also an assistant professor of pediatrics and neurology. She's a clinical co-course director for the Phase 1 Neuroscience and Behavior course, as well as the Neurology Clerkship Director. And she also directs the Pediatric and Adult Concussion Center at Hackensack University. Within the AAN, she participated in the Emerging Leaders Program in 2018 to 2019, and since then has been an active member in the AAN and serves on the Undergraduate Education Committee, as well as various subcommittees and work groups. And she resides in Rockland County, New York with her husband, 3 children, dog, and enjoys hiking, going to the beach, and skiing. Joy is a recent graduate of Texas Tech Medical School, where she served as the sign president, setting up shadowing opportunities, speakers, and encouraging engagement in the field of neurology. She's been an active part of the AEN, serving on several committees and subgroups, including the Pipeline Subcommittee, and has been tasked with supporting and encouraging today's learners to consider a career in neurology. She completed several away rotations over the course of her MS 4-year and matched at UT Southwestern in Dallas for residency. And then Dr. Mazenkai became the Assistant Dean of Student Affairs at the Charles E. Schmidt School of Medicine at FAU, or Florida Atlantic University, at the start of April this past year. Immediately prior to that, he directed the clerkship and residency at the University of Arkansas for Medical Sciences in Little Rock, Arkansas. So as a reminder, please submit all questions in the Q&A box. And I think with that, we'll go ahead and get started. And so, Joy, I just want to kind of start with you. And if you could just, since you're the closest to this, give us a little bit of an overview of how, our topic tonight, away rotations, are structured and how they differ from rotations that folks may be more used to at their home institutions.
Absolutely. Good evening, everyone. So away rotations are similar to clerkships that you guys are most likely you're completing or about to complete, in the sense that you are doing patient activities or patient interaction, you're helping out with residents and attendings, you're presenting, but they do differ in the sense of the length. So many clerkships can be upwards 2 months long, 8 weeks, 6 weeks. A lot of away rotations or acting internships can be 2 weeks or 4 weeks long. And then the responsibilities that you tend to have at OA rotations are a lot more, like a lot greater. So the sense that if you're used to taking maybe 2 patients as a 3rd-year med student, you may be tasked to take 4 or 6 patients as an OA rotator. So those are the big differences. It's really the workload or the amount of work you're expected to do, and then the duration of time. And they're often, again, not at your home institution, but somewhere else.
Perfect, thank you. And in terms of applying for these rotations, Dr. Mazenkai, do you have any sense of like how the application process typically works for these and what resources could be available to kind of help students find places where they may be able to rotate outside of their home institutions?
Yeah, so generally speaking, I think VSLO tends to be the primary resource to find these rotations online. I think maybe the biggest thing is for the students out there apply early, because a lot of these spots will start filling up quickly. And there's a bit of a first come, first serve mentality to being able to take these students on. Keep in mind too that there is a whole application process that goes with this. So a lot of institutions will ask you to complete a whole form. It's almost like applying to residency, beforehand. You have to send oftentimes like a little personal statement, transcripts, and things like that. The other thing too that you may not be thinking about if you're an M3 currently and then thinking about doing aways is that compliance and things like that that you have done at your school and your hospital center that you're not really paying attention to because it's done and dusted. You'll have to do it every time you go to a different center. So I think the biggest thing is to take a look at their immunization requirements and make sure that you're up to date for what that hospital system specifically has, because that can delay you. That can cause you a few weeks to months even in your ability to get your rotation, which can have downstream effects on what you want to do with your early M4 months.
Thank you, Dr. Glicksman. Do you have any additional insight, in your role as the clerkship director at your institution in terms of, away rotators being able to apply in, or any advice that you might have for them in terms of the application process for an away rotation?
Yeah, I think also just to kind of echo what everyone said so far is, apply early, but also, apply where you really want to go. It's like a little job interview or a big job interview. And so if you want to do an away rotation, but you have, no inkling at all to go somewhere, then really don't apply there and take that spot from somebody else. And again, the whole point is trying to figure out, if this is, where you do see yourself. So, is this the region that you're looking for? Or if you're open to anything, then yeah, spread your wings and spread the net and, apply to however many. So, and also taking into consideration, downline effects of, the cost of being there for so long. So, the cost of living in that area and funds, which we'll talk about in a little bit.
Awesome. And Joy, just for, planning purposes, what would you recommend in terms of being successful in getting one of these set up? Like, how far in advance should students be starting to look ahead at these things, and how long does the application process actually take?
Yeah, so I guess I will answer kind of what I did and then go from there. So I started thinking about away rotations January of prior to my M4 year. If you haven't thought about them just yet and you're entering M4 year, don't freak out. But that's what I did. I thought about them, just had a general idea of where would I want to go, how I'd narrow down the institutions. And then I started applying in April of prior to my M4 year, or the springtime of the MS3 year. And all the applications were maybe solidified and done by May at the latest. And then I started hearing back from May onwards into August about away rotations or opportunities. So depending on when your school ends their MS3 year, I would recommend at least 6 months, 5 to 6 months prior, I would start thinking about kind of where do you want to go, what institutions to consider, and so forth.
I guess just opening up to the panel, obviously if with travel, living in a different area where you may or may not have family located, do any of you guys have any resources that you found to be beneficial for either from other institutions or outside organizations to kind of help with funding for away rotations?
So I'll try to answer this question. So it can be tricky with funding for away rotations. Like obviously they're expensive. You have to travel out somewhere, go to a new place, find a place to stay for that 2 to 4 weeks. Travel can be tricky as well. Looking at some of the resources, for example, the AAN has a visiting medical student scholarship that's out and about, and I'm sure at some point we'll send a link up there. The other thing that I found, and Joy, you may be able to add to this, is the FARMS database. It's a resource for underrepresented in minority, and that's a lot of different demographics. And I think what's nice about that is they'll actually show you what specific groups each school has opportunities for. So I think that's a good place to start as well. So
absolutely, I echo exactly. The FARMS database, in addition to the AAN, was very immensely helpful. I think I only applied to away rotations that were actually on the FARMS database that could help with funding, just because away rotations are so expensive. So yeah, absolutely, the FARMS database, 100%.
The other thing is, I think it's probably few and far between, but you never know if you don't ask if your own institution does have some supplemental, money to help with away rotations. or even like those types of local scholarships as well. So definitely try to take a look into your own institution as well.
And just one last thing in terms of, as we talk about logistics of this, we talked about the application process. When you plan out the academic year, are there certain months that any of you all would recommend, applicants kind of avoid as terms of months where they should maybe not do an away rotation, just because of logistics of everything else that's going on?
Yeah, I mean, my bias is those prime interview months are probably, you want to try to avoid those. So usually those start to open up in mid to late October and then run through about January. January is when they start to peter out. But I think the tricky thing about doing an away elective, essentially like an audition elective while you're potentially interviewing, is it's hard to spread the energy out across those two efforts. So you guys in the audience have not done these interviews yet, but they are a full day affair. And so they can take a lot out of you. And then also there's if you're there and you're trying to make your face known to everyone, if you're gone for a lot of the time, it's not the intention, but it may create the impression to some that like, hey, where is this person? So you may not get as much bang for your buck out of those experiences if you go during those months.
I would also caution around when the ERAS application is due. If you are going to do an away rotation that kind of extends into September, I would just maybe ensure that you have at least a week so you can kind of finalize and sum up your ERAS application. So that, in addition to the winter months of November and December, I would avoid, definitely September would be something kind of be careful to consider.
So once, you have an away rotation set up and you're all set and ready to go, you have it lined up, you got funding figured out. How would you guys recommend students go about preparing for that rotation? And, how important do you guys feel away rotations truly are to their total package as it pertains to their application into residency?
I would recommend, obviously if you're doing, a rotation in the movement disorder clinics, for a month or, really studying and barreling down on, that specific topic. Obviously if you're doing more of a broad, gen neuro away rotation, you're going to have a lot more to read. But, really coming prepared and understanding the pathophysiology, the common medications that are involved, or treatments, get your neuro exam down pat, even just starting with your basic, neuro history, and review of systems, and, just really making sure that this is your time to shine again. And so, you want to have the answer to every question that you may be asked by that attending.
Yeah, I think the one thing that to realize when you're doing these electives, when you're in M4, is that you don't have to take a test at the end of the block like you used to. So you do have you have time to actually prepare for the things that are like coming through that door at that moment, more so than you have in the past. So Dr. Glissman said, like, you better know, like, it's a good opportunity to know your stuff down cold. So depending on what specific rotation you're on, like, know that stuff well. Certainly know your neuroanatomy well, because that's one very, if people are going to ask you, test your fund of knowledge, that's one great way to test it, no matter where you're at and no matter what rotation you're doing. So just generally speaking, like, those things that are specific to those rotations, like, really, really know them cold.
Just to add a couple of things that were helpful for me. So one, like was stated, knowing your neuro exam very well, like very fluidly, is obviously very important. Having your tools, your pen light, your reflex hammer, your tuning fork, all of that would be very good to have. But also for me was knowing how to run a stroke code, which was something I didn't necessarily have experience with before entering my away rotation, but having just some general idea of what is done, how that works, was helpful. And then assessing a comatose patient was also something that was incredibly helpful for me to know beforehand.
And ask your mentor at your institution to run through all this with with you before you go. They really want you to shine as well. So don't be afraid to ask them to, take a few hours or an hour just to kind of run through things with you.
Do any of you guys have any experiences that stand out, good or bad, either doing an away rotation yourself or supervising or having a visiting student in from an outside institution that kind of stands out in your mind in terms of an example of what to do or what not to do, or just the value?
When I have a visiting student, I read the patient and the families. I'm a pediatric neurologist. So if I see the parents making a face at me, obviously, for me that I pick up on that. But otherwise, again, some of these are, my longstanding patients, and the best compliments are the ones that come from the families afterwards. So it's really, first, a big thing with me is how you build rapport.
Yeah, I think one of the things to consider in all this is that when you're out there for those rotations, I think the one thing that's helpful to do is shift your mindset a bit from it being from a rotation that's a part of school to you being at work. So what can I do to make my coworkers' lives easier? So obviously that's not coming in there with like a cup of coffee on day one. You look like a weirdo if you do that. Or like with like a 6-pack of coffee for everyone. That looks a little bit too much. But like, what are the little things? What's the workflow like for the team? What are the things that you can do to aid in that? And obviously some of that is knowing your stuff and being able to do a neurologic exam and get a good history. But what are some of the other things in the workflow, with the way that they run rounds, or then in clinic? How do they get, is there a way that they happen to do a pre-encounter chart biopsy? Is there a way that you can help with that? Just look at those sorts of things. And then obviously the next thing is like, try to make sure that you get along with the people that you're working with. This is also another work thing. Like if you're really smart, but no one really likes you, everyone will find out. So, make sure that you are able to get along with folks. And again, just think about like, how can I make how can I make my coworkers' lives easier and a little bit happier? Best way to approach it.
Yes, absolutely. I was just going to recommend like your first week, or your first few days, I should say, will be the days maybe where you are at least expected to know the most, or the least, if I should say. So I would, those few days, I'd be very careful, like assessing how people are doing stuff. And then so that you can help them out for the remainder of the rotation. So for example, the first few days, if you see a lumbar puncture is being done and you see where they get the resources, and you see what they do in the process, keep that in mind, and then do so afterwards, and that will help you shine and stand out. I think there are many times where a lot of the residents were like, well, thank you so much for helping prep this. It saved us 5 minutes of running across the hospital, because you saw where we got it the first time and you didn't have to tell you, the next time. So that's a good way to stand out, and things that made me at least shine when I was on away rotations. Another thing to keep in mind, and I remember very saliently, was keeping in mind where you're doing your away rotation, and if you are going to a city that is not quite similar to the city that you live in. So example, I'm from Texas. The South and the way of life in Texas is very different from the East Coast, which is where I did all my away rotations. And so keeping that in mind and being prepared, like with public transportation, knowing that ahead of time so that it doesn't become a terrible factor later on. I know there was one day I was taking the bus to and from the hospital, and the bus like stopped working, and so did the trains. And I was like, how do I get to where I'm going? And so that was stressful and terrible. But having in mind alternative ways to kind of navigate the new environment would be very good to keep in mind.
And with that, good communication with your team, right? So I'm in the Northeast, and I know probably whatever happened is very common up here with the buses and the trains all stopping. But when it does happen, so just making sure to have proper communication with your teams when things may occur. Again, that's going to be most appreciative. Not this, you showed up 2 hours later and the bus broke down, but good communication, and letting people know things right away, whether it even be patient care, right? Not just personal things, but communication is going to be key.
Any other strategies that you all would recommend for students to kind of help them, kind of stand out or be successful as they go into their away rotations?
One of the things that I tell my students, and not even just for away rotations, but again, how to be the most helpful, is also thinking about, the social determinants of health. And again, taking that extra step to kind of, I say, read the room, but even read the patient. And helping with the flow, as we're talking about the flow of rounds, is, you guys do have that extra time with those patients. And even asking, okay, what's your pharmacy? Oh, you have a pharmacy, but you don't have a car. Do you have a way to get there? You don't. So maybe I have to speak with the social worker to find a place that delivers, the medication for you. So even just that little hiccup of, discharging a patient who can't get the medications is going to slow that team down with now trying to find someplace that we can then send the meds to, and it's going to delay that discharge also. So just like those little things, again, can help decrease length of stay and, easier discharge, not having the attending or the resident have to put in 20 different prescriptions 20 different times. So really kind of taking that step ahead and thinking ahead will really, again, I think, raise you up in the books.
I think I'll add one other thing, which I don't think we really touched on, is that when you're on an away rotation, you're really supposed to be on all the time. And that includes not just work in clinical situations, but sort of that off downtime social situations. So, if the residents want to hang out and they invite you, you kind of should go, right? Also, like it's sort of a weird look if you don't want to go hang out with your coworkers or future coworkers. And B, you're also there to figure out if that vibe works for you. So, maybe you missed your opportunity to find out that these people are awesome, you really love them, or the opposite, you missed your opportunity to learn, oh my God, I really don't like these people. And you never know until you actually go and hang out. And then on the flip side of that too, or the thing to add to that is that be careful about what you say, especially in a new environment with new people. So you never know what sort of politics are about you or around you, and what people think on that end. And then humor too. You may have your group of friends where where such and such a joke is funny, but like just keep it to like dad jokes at first, just be very careful about that sort of thing. You can really sink yourself by just doing one wrong thing or rubbing one or two people the wrong way, and that'll sink that entire month's worth of work. So I think that's one thing to keep in mind, that you are always on during that month.
Obviously going into these rotations, oftentimes they're sub-Is, they're kind of a little bit higher stakes, even though there's no tests at the end. But you're also adjusting to a new environment, new EMR. Like, what advice do you guys have for kind of acclimating quickly enough that you can kind of be as authentic yourself as possible when you're at one of these rotations and outside of your comfort zone?
So prior to going to any new city, I would personally research that city like from head to toe in regards to how do people move around, where are things, how do you access things like food and transportation. That would be very helpful. Then I would also arrive to your away rotation at least 3 days if possible before the actual start of the rotation, so that you can pick up any badges, you can figure out where you're staying, if there's any problems with where you're going to be living, you can change plans or change course of action. You can maybe walk to the hospital or drive or whatever it is and see that course of like that pathway that you'd be taking daily, so that the first day you're not kind of trying to figure all this out, or in case something happens, you have ample time to kind of be settled and not frazzled starting the away rotation.
One thing I'll add too is I think in medicine, we're kind of afraid to ask, but this is a situation where you're essentially starting a new job. So don't be afraid to ask how people do that part of the job. Whether it be, getting supplies or certain parts of the EMR, like, sometimes as a sub-intern, you may be in this limbo where you're like, what am I allowed to touch and not touch? Ask. There's a lot of assumptions that you may have in your head and assumptions that the other person may have in their head, and you don't know if they match up unless you ask. So it doesn't hurt to ask. Obviously, you know, don't ask like obvious questions like, oh, how do I do this exam piece? Like look that up. But like if it's like, how do I call phlebotomy? All right, just tell me now so that I can do this for the rest of the month for you and you never have to think about it. You are like a hero immediately. And that's like a really minor thing for us, it seems like, but for an intern or a second or third year resident, that's like, oh my God, that's amazing. That's like 15 minutes of my life every day. I don't have to do that. So ask.
You know, we've talked about, you know, the acclimation period. How about, you know, every institution, even though we talk about a lot in ACGME about feedback, how as a medical student can you kind of calibrate yourself as you're moving through this environment? Like if, you know, it's going to be different in every institution, obviously, but any strategies that you all have found that are beneficial for students to kind of get timely feedback and incorporate it in time that they can make the rotation as successful as possible.
So I would hope that during clerkships, you have all, you know, learned how to ask for feedback and ask for it early in the rotation, whether if you do, you know, a different week during your neurology clerkship or any clerkship, you know, start on day one and think of the one thing that you really want to work on and tell the attending early on that day and say, hey, you know, I really want to work on you know, my cranial nerve exam, you know, this is a neuro-ophthalmology clinic, right? And so, you know, can you watch me and can we talk it through and etc. So, you know, saying something at the beginning of the day, something that you really want to specifically work on. We specifically have things called growth goals. So think about what even your growth goal would be for this, you know, your growth goals would be for this away rotation and how to work on it. And then, you know, keep asking for feedback on those goals.
Following that, you know, asking for feedback, being open to feedback, I think generally is very, very important. I've seen a lot of times students, you know, say they're open to feedback and then they are provided feedback and then they become defensive or, you know, oh, I didn't do it like this or, was, or something like that. And so I would just caution on that too. It does rub people the wrong way when you get defensive when they're trying to correct something. So being fine if you are doing a neuro exam in front of someone and they adjust something or adjust your hand or whatever, being like, thanks for that. I didn't know, or thanks for correcting me. Be sure to do it, you know, again or in the future. So that would be helpful.
Yeah, I feel like generally speaking, if you're willing to ask for and accept the feedback, that really quickly puts you like a rung above most of your peers, because I think even as residents and attendings, that's still like an adjustment for some of us. So if you're, I think it's important, and starting now, if you haven't already, like think about feedback as like a gift, because someone is giving you this feedback because they want you to either do something that you're currently doing and either continue to do it so that you continue to be good, or to stop doing it so that you can get better. You know, if someone didn't want to put the love and care into your success, they would kind of just let you flop in the breeze and hope for the best for you. It does take a lot of extra energy to go and just tell you something. Because I mean, admittedly, it's a little bit easier to just kind of let it go. So accept it and think of feedback as a gift, even though it can kind of, it initially will sting, but in the long run, it is meant to help you grow.
And this is always kind of a challenging thing to navigate, but in terms of if you're planning on getting a letter of recommendation from an away rotation, you know, you're only with a group of people for a brief amount of time. You know, I'd be interested in hearing from everybody on the panel, you know, kind of their take on, you know, ways to get a strong letter of recommendation, but then also how to navigate when and who to ask for that letter of recommendation. Um, I think the students would appreciate.
Do not wait till the end of your time there to ask for that letter of letter of recommendation. Again, as we talk about feedback, you know, you really want to start that, you know, improvement process or your shine early on. So, you know, I would definitely think by the midway point, figure out who that person's going to be that you want to ask, and let them know that you plan on asking them at that time. So then you know, they could, you know, keep an extra eye out on you and, you know, almost like that mentor relationship, you know, a little earlier on.
Yeah, I think the discussion about feedback, you know, sort of leads into this, where you want to ask relatively early and try to get that feedback fairly frequently, so you aren't just guessing as to whether you're doing a good job or not. Because we kind of assume or like have a feeling of how we are doing, but we may be completely wrong. And it's one thing if you like are wrong in a good direction where you think, oh, I did average, and they're like, oh, you're amazing. But like, what if they actually thought you had like this one glaring weakness that you could have fixed, never told you about it, but then it winds up on your letter of recommendation. So just ask, be very proactive about asking. And then, at the end, then you can ask, or towards the end of the rotation, then you can ask, hey, with how I've been doing, like, do you think you'd be able to write me an excellent letter of recommendation, or am I just sort of mid?
So I was specifically told by my attending that if I wanted a letter of recommendation, I should ask no later than the end of the second week, or at least halfway through the third week. So that was specifically told to me. So that's something to keep in mind. When asking for a letter of recommendation, at least at the institutions that I did away rotations at, they actually used feedback from all the attendings and residents I worked with. So it wasn't just strictly the attending I'm asking, but it was like a whole group, a whole cohort of people essentially writing my letter of recommendation. So keep that in mind with who you're working with. It's not just that attending, but it is everyone that you're working with, all the residents and so forth. So.
Any other last pearls you guys want to share before we kind of dive into some of the Q&A that's available in the chat?
I would say one thing. I think away rotations were shockingly expensive, like way more expensive than I could have ever imagined or planned for. So I would really start thinking about that. Like whatever you think your away rotation is going to cost, double it and just be safe, because they are pricey. Like, the story I told earlier about the bus system, transportation system being down, I had to take an Uber. Well, that didn't happen just once. It was multiple times of having to take an Uber to the hospital. Those add up. There are a lot of times where I was staying in an Airbnb that wasn't completely like furnished with all the cooking utensils. And so I had to eat out way more than I ever thought I would have to eat out. I think one place I had to rent a car because I couldn't drive my car across the country. And so like it really added up really quickly. So keeping that in mind, maybe that may dictate which away rotation you do, depending on the expense. And then also keeping in mind that away rotations are a lot of fun. I've made a lot of friends across the country at these different institutions. And so, making sure that you are having time to talk to the residents, get to know them. If they're going out to happy hour, go with them. If they're going to a concert, go with them. And so just keeping those in mind, I think you'll do well.
My pearl is to be friendly to everyone. Everyone's part of your team. The unit clerk can make you or break you. The nurses, respiratory therapists, ask the respiratory therapist what they're doing, right? Really get to understand, what everybody's role is. And, again, if this is where you're going to end up, they're going to remember you. Trust me, they will remember you. And if you weren't nice to them, they will remember you. So make sure to put on that friendly face to everyone.
Yeah, I often tell students and residents to be nice to everyone, especially if they're not an MD or a DO. So they really, we can't do our jobs without that staff. So be nice to them, because yeah, I mean, if they're not happy working with you, they'll let us know. They'll let the staff know, they'll let the program director know. So be nice to everyone that you work with. And then I would, I've mentioned it before, but thinking about these rotations as sort of an extension of work is a good way to sort of mentally frame it. And I think that'll help you during those rotations.
Awesome. So I guess we'll just kind of go through the questions that are in the Q&A. So the first one, I think we can kind of generalize it. So it talks about, wanting to practice in a warmer climate, preferably in the stroke belt. So do we have any recommendations? So I guess what this is getting at in terms of doing away rotations, would you say trying to set those up in an area of the country that you're interested in residency and ultimately practice, does that seem like a good strategy to take?
Yeah, absolutely. I would say if you don't have ties to a certain geographical region, I think an away rotation is like, if not the best way, if not the only way you could really show some tie. I've had so many interviews where the program director was like, "You're not from here. Why are you applying here? You're not, what are your ties to this region?" And if I did an away rotation in a region, I could say, well, here's X, Y, and Z reason. I lived here for a month. This shows my dedication. I know what it's like living up there. So yeah, if you were having a specific geographical tie, I think doing an away rotation in that region would be like the most efficient and the best strategy for sure.
And make sure to apply to a lot, right? Because you may not get it. And by the time you find out that you didn't get it, then the other spots will be taken. So if you are interested specifically, again, for that South, and there's only a few institutions in that region, then you really need to, again, cast out that net.
Yeah, I think I'll add on that it's the stroke belt is still a pretty big region. So this is where it's good to take a look at those websites that residencies have. I think one of the few bright spots from 2020 was that a lot of residencies sort of realized that a lot of that information was coming from their websites. So they made a lot of effort to update them as best as possible and to really showcase what they're all about. So think about what it is that you want out of your training, and then further down the line, what you want out of your eventual practice, and how that particular program might offer something either either what you directly want, or at least lead you in the direction that will help you in what you're aspiring for your career. So do some research before you apply, so that at least, when those invites start coming in, you have a sense of like what you want to take and what you don't want to take.
And then I know we kind of talked about the other one here about, doing an away rotation during interview season. We talked about trying to avoid that as best as possible. It looks like whoever wrote it in talked about if it's a top 3 program for them. I think I'll leave open up to you guys, but if it's a top program, what are your thoughts if that's the time period that they're being offered?
I mean, I guess it depends on how badly you want to be at that one particular program, because you're probably, there's with the holidays, there's functionally 6 weeks during the November, December block. And you know, jump in if I'm inaccurate on this, but like, I feel like if it's like a spot where like, oh my God, I would like sell a kidney to be here, for whatever reason that is. But like, if that was the case, yeah, maybe that's worthwhile for you. But keep in mind, I think we had mentioned earlier on that residencies are an all-day affair. So not only will you be kind of MIA, not obviously MIA, but like you'll appear MIA for that time, but it's going to take away from your energy to be able to do your job during that rotation. And so that, people may be cognizant of that, but it's going to affect your performance during that time. We talked about that away rotation, you have to be on the entire time. This can affect that too.
One thing that you could try to figure out with your schedule as, doing an away rotation as sub-I is if it's Monday to Friday and you need to go do an interview, offer to come in on the weekend, right? So offer to make that time up. So that really, again, shows your interest, and that you're just not there for a Monday through Friday gig and you're willing to make up that time.
I would just really avoid doing an away rotation in November. Honest to goodness, I think most interviews in neurology world is very, they do take place in November and December. I think November, December, there was like at least 2 interviews or 3 every week. So, so then you will end up being out a lot, like more than, would be maybe acceptable. A lot of away rotations, they have stipulations of how often you can be away. I think it's like at least, what is it, like 2 times or so, or 2 absences you're allowed. And so it can get kind of iffy and, uncomfortable. So I would caution against it. And then also keeping in mind that just because you're in a way at an institution doesn't mean that it will go well at the institution. And so I know that's kind of pessimistic and cynical, but it is possible to also not, still end up at a place where you didn't do an away at, and also, do an away at an institution and then almost backfire. So, just kind of keeping both ideas in mind.
What about when you're at the away rotations? It looks like some of the questions are centered around, opportunities to meet with program directors there. Is that something that you guys have seen as commonplace, that away rotators get a chance to meet with an APD or PD, or is that something that would be a reasonable ask of a medical student doing an away rotation?
Half of mine already had the PD appointment set up, or a PD appointment set up, but then the other half I had to ask. And I was able to set it up really quickly. So it just depends on the institution and kind of the vibe, if you will. But I don't think it's a crazy ask to meet with the APD or the PD. You may run into them just naturally throughout the course of your away rotation, but I would definitely at least show face to the PD or APD while you're at the institution, if possible.
Yeah, I feel like, and I'm not a program director anymore, but like if someone were rotating from another institution, like I'd want to at least like accidentally run into them and talk to them and get to know them a little bit. Because I mean, odds are if someone is rotating with us, well, that program would likely offer at least a courtesy interview. And so the question is, we've seen them in the flesh. How are they going? How much do we like them So I think it's not it's sort of, in my mind, it would be an expectation for the program director and assistant program directors to want to meet with you. So yeah, I think like Joy said, if that's not already prearranged, don't be shy about asking, like, a little bit into it. Hey, is there a chance I can set up a meeting with the program director? So no, I don't think there's anything weird about that.
And kind of going along that lines, once you've met them or if you get to work with the program director or APD, are they fair game to ask for a letter of recommendation?
So I'll go ahead and jump in on this. So I think generally speaking, it is probably best to have a letter of recommendation of someone that you've worked with on the floors if possible. I think some specialties expect a letter of recommendation from either a program director or chair, but understand that odds are, unless you've been working with that director or with that attending face to face for a meaningful period of time, you're probably just going to get a composite of quotes from other people. So the letter of recommendation that you get out of that in terms of the overall value to your application may not be what you were hoping it was, because we can, the people look through admissions committees can look at that and can tell that, oh, they didn't actually meet with this person. Like there's nothing but air quotes from other people here. So that's just something to keep in mind. Ideally, you might want to ask, is there a possibility after you meet with the program director, is there a possibility to work with you to get a sense of what you're all about? And then if that goes well, maybe some more time can be arranged. But I think if you have some good rapport with that program director, sure, but I wouldn't necessarily force it. I'm curious as to what you guys think.
I would say if you work with the attending or the program director APD, I would 100% ask for a letter. If not, it's a little iffy, to be completely honest. I didn't do that, so I can't speak on that entirely, but I would just feel like it wasn't going to be a very genuine letter to begin with. Instead, really get one from an attending I think an attending that you worked with that can speak to your qualities would be better than a PD or APD that you don't really know.
Yeah, I think neurology is a small enough crew where like enough people know each other. So it doesn't have to be a chair or a residency director writing your letter for people to know, oh yeah, I know that person, So again, I wouldn't necessarily force that based on a title at least.
I think you said it earlier also, Neil, is that when you ask for a letter of recommendation, you're asking, are you able to write me an excellent letter of recommendation? Keyword there is excellent, right? So if you didn't really work with them, do you expect them to be able to write you an excellent letter of recommendation? That's really what you should think about.
So I think, you guys, your comments, and feel free to interject if I'm overstating it. But I think a lot of your comments have answered a couple of these other questions, just so we can move beyond just the letters of recommendation. But there was a question about getting multiple letter recommendations from a single rotation. And while that may be possible, if you want an excellent one, you really want somebody that you've invested with and worked with for a period of time. And with these only being oftentimes 4 weeks or less, it's a lot harder to work with multiple people and have multiple meaningful clinical interactions. So it depends, but it's probably a higher yield one is probably expect to get one from an away rotation. And then in terms of finding out who to get a letter of recommendation from when you're there, it sounds like, based on our discussion, those attendings that you had the most cross paths with the most and saw your work the most would be the best person to ask. But any thoughts on asking the residents on who to approach for a letter of recommendation? The person writing in said they didn't want it to look like, gaming the system or just looking for the nice attending. But is it a good strategy to ask residents early who to get a letter from?
I would say if you were going to ask a resident that, I would maybe just pick one or two. I wouldn't be asking the whole cohort of residents, like, who should I get a letter from? Because that can come off wrong. I don't think it's outrageous to ask a resident, like, you know, how has that attending been with other medical students, other visiting students? I don't think that's crazy. I don't know if I would be so on the nose with it. But yeah, I don't think it's absurd to ask. And I would maybe ask one of the residents maybe you're closest with, or you know, you trust maybe the most. I would consider that.
And one important question that's in here is, you know, any advice that we could offer for somebody that's interested in a program that does not offer a neurology away rotation?
Yeah, that's tough because a lot of that is dictated by really levels above the directors. And by directors, I mean clerkship and residency directors. So it may be a hospital system thing. It may be a residency system thing. In my old institution, you know, that we had certain rules about who could even just volunteer. So, you know, those can be tough if there isn't a specific opening for an institution that you're looking for.
Yeah, I have to second that. I think you know, even at my own institution, you know, there's certain people, you know, certain rotators that we cannot take. Does it hurt to pick up the phone just to ask and make sure? No. What's the worst thing that can happen? You still get the no. Move on. And then I always viewed it, well, I guess they didn't want me anyway, and it wasn't meant to be. And you know, so you know, you'll find your place, but you know, pick up the phone and ask if you're really or send that email if you just want to question it further.
Yeah, I think, you know, if that happens, those are about institutional rules and regulations and nothing personal or, you know, so just keep that in mind, you know, if those come in. So
And you know, you could see I'm a DO, and a lot of that has, you know, the DO mentality has shifted a lot since I graduated. I trained in Florida. It's a big DO state. I'm in New Jersey now. You know, definitely more DO friendly. But you know, that hole is really, it's shrinking, and so there's, you know, there's not much differences in a lot of places now. So again, that's why I took it as, well, I guess they didn't want me and they don't know what a DO is anyway. But you know, hopefully you're not coming across that too often anymore.
I did run into something actually really similar. I'm MD, so it wasn't really due to the MD DO stuff, but I emailed and they said they weren't offering one, and then I ran into the PD at the AAN conference, and I told her, I was like, "Wow, I really want to do an away at your institution, but they're not offering one. That's, you know, it's bumming me out." And she actually set one up so that I could do one. So it doesn't hurt to ask. I'm just, you know, reiterating that it doesn't hurt to ask. If still you can't do one at that institution, considering maybe a place nearby, so that you could at least get the sense of the region and the general patient populations that you could run into.
And if you have the fortune of doing more than one away rotation, does it make sense to, in terms of prioritizing, would you do the one that you're most interested in first, or would you save that one for second so you have kind of a warm up, if you will, before you go to your second away rotation?
The away rotations I did towards the very end of my away rotation era, if you will, were far better than the ones I did at the very beginning. It's crazy how even just like 8 weeks, 4 weeks can make a difference in your skills and your knowledge base. So I would personally recommend the one that you are most wanting to shine. I would do it like last or later or second or.
We have time for one more. This is a tough one. You know, we talked about the cost of these rotations, but in terms of the amount of investment that students are putting into the rotation, when it comes to letters of recommendation or certain experiences, whether it's procedures or types of patients that they would like to see during that rotation, how pushy should they be while they're there? And the writer writes in a scale of 1 to 10, but in terms of, you know, because there is a cost associated with this, but you know, what's a reasonable level of expectation in terms of having some say in how the rotation flows?
That is a toughy one. Nobody likes a pushy person either, but we also want to see engagement, if that makes sense, right? We don't want to see you just sitting off to the side and not engage, because you're there for, like you said, you're investing into this rotation. So, you know, we do want to see you volunteer for things. Again, if you get told no, you can't do it, at least you ask, and we see that enthusiasm to learn. And then I think from that will drive your pushiness for a letter of rec. But you shouldn't have to be pushy. Someone should just say, sure, right? And so I think that's, again, reading the room and the people that you're with.
Yeah, I think it depends on the situation and what you're asking for. If it's a letter of recommendation, right? Just ask, and you know, you guys have found, you guys probably have found, or you guys have probably seen that, like, sometimes if you ask for a letter of recommendation, it can take longer for that to get completed, so you have to keep pushing, and that's totally normal. But like, if you're just in a work situation, you like, there's a specific patient you want to see, but it's assigned to someone else, it's done. Don't be like, I'll trade you, my patient for that patient. No. But the assignment has been made. So don't just figure out what the right situations to push and ask are.
As it pertains to things like experiences of procedures, I would recommend at least seeing one of them first and getting to talk to the resident about that first before offering to help with one. So example, lumbar puncture, I would watch a resident do it first, see how it's done, and then the next lumbar puncture, be like, hey, can I try? And see how you can get the most out of your rotation that way.
All right. So I think we just have a couple minutes left here on the hour. It kind of flew by. But I want to thank the panel, obviously, for all their insight and time. So Dr. Glicksman, Dr. Mazenkai, and Dr. Josephs now, right? And unless anybody else has any comments or concerns, I think that this concludes the program for this evening.